All right, could the country be moving to lockdown level 1 soon? New infections have been declining and the recovery rate is over 89%. National Chairperson of the South African Medical Association, Dr. Angelique Coetzee, speaks to us now about the situation in the country and if level 1 could be imminent. Dr. Coetzee, thank you very much for your time. Could we be moving to level 1? I mean, the Transport Minister already saying that they are going to open up for international travel, but is it safe for us to now move to level 1?
Thank you, and good morning to all the viewers out there. From SAMA's side, we should move to level 1, and I think there's a 99% chance that it will be announced. We cannot stay at level 2. We have to go down, as I've said, to level 1, and SAMA will support going down to level 1. And you know, mindful that we still keep an eye on the what is happening at the casualties, so that our casualties are still functioning in a proper way and not overwhelmed again by maybe an increase of numbers again. But we have to move down to level 1.
I was actually going to ask you that, Dr. Coetzee, because the last time we moved to a lower level, we got afraid that we might be moved back to a more stricter level because of the fact that our casualties started becoming busy and, you know, nurses and doctors were basically overwhelmed because of the number of people who had to be taken to hospital. So looking at the fact that it's now springtime, summertime, more activity is going to take place, people are going to relax a little bit more. What would be SAMA's advice to South Africans about the fact that it doesn't mean we're out of the woods?
Yes, I think it's extremely important to emphasize that we are really not out of the woods. If you look at the numbers that is displayed every night on television programs, there's still a significant number of people that's infected. But as you correctly said, we're moving into spring and summer. It means that South Africans will be predominantly more outdoors. And as we all know, the problem is not so much outdoors, but indoors, where there's lots of people coming together, especially with your churches and, in meetings where there's more than 50 people. We still need to understand that going down in the lockdown doesn't mean we need now to abandon again the mask, the hand washing, the social distancing, and good ventilation in your workplace situation. Also, SAMA would like to see that if we go to level 1, that there is some emphasis on how many people can attend a closed church meeting. It's another case if the church meeting is out in the open where there's, again, natural ventilation. So this will be something that we really need to watch. And as we correctly said, moving from lockdown 3 to lockdown 2, we didn't experience an extra burden in the casualties. So, but South Africans need to us, please, to understand it doesn't mean the virus is not here.
Doc, would SAMA also support the reopening of the borders for us to be able to travel to other countries and people in other countries to also visit South Africa?
Well, if you look at it from an economic point of view, SAMA will support, but SAMA will also caution that if we open the borders, we again need to have or a very, very, very strict control over the numbers and what is happening and where the hotspots will, maybe emerge. And looking at that and the data is so important. So if we can manage the data and opening the borders, but also being able to close them again if we see that, we get an increase in cases, then that would be, SAMA would then be in favor of that. But it cannot just be a blanket opening and everything everything must go back eventually to normal. But we have to open it and then reassess, open again, reassess, and move forward in that way, because there is unfortunately an economic aspect to this as well.
Well,
and we also need to make sure that we all understand, the quarantine measurements if you come in from another country or if you go out. Otherwise, going for 5 days into a congress overseas, 2 weeks there in quarantine, 2 weeks here doesn't make any sense. And again, before I close down, Sama again would like to thank all the healthcare workers out there and their families for being so supportive and all the hard work that they have done and are still doing during this COVID time. Thanks.
Well, thank you very much. We are expecting, of course, the President to address the nation sometime this week. That is the South African Medical Association's Dr. Angelique Coetzee. Thank you.